Thank you, Madam Deputy Speaker, and it's an honour to follow the member for North West Norfolk, who made an excellent maiden speech, along with many members across this House this afternoon, and I wish him well, and I look forward to working with him and all new members. 2 months ago, Madam Deputy Speaker, I stood in this chamber and spoke of my disappointment that the Queen's speech only included one reference to mental health, a reference to the Mental Health Act, rather than a systematic programme to tackle mental health across all demographics. According to research by the Children's Society, of the 22,365 children in Birmingham Edgbaston, an estimated 2,733 5 to 19-year-olds are struggling with mental ill health. That's more than 10%. And at the same time, money available for local services for children and young people has fallen by 38%. Is it any wonder then that just last week research by Education Policy Institute revealed that more than a quarter of child referrals to children and young people's mental health services in England last year were actually rejected? But even when a referral was accepted, many children still had to wait an average of 2 months to begin treatment in 2019, double the government's 4-week target. Birmingham Women's and Children's Hospital has a median wait time of 112 days. That's almost 4 months. A decade of neglect in early intervention care and an under-resourced mental health services sector has meant that many more young people are turning up to A&E. I hope that the government would have listened when I raised this issue in the last Queen's speech, but given a second chance, the Prime Minister has failed once again to show that he is serious about tackling mental health. Yes, reform of the Mental Health Act is important and most desperately needed, but the government also needs to properly fund vital preventative services. And for the many new members of Parliament, I will repeat the shocking statistic that failed to elicit any action last time. For the whole of Birmingham, there is only one early intervention counselling service for young people. And the most recent waiting list has 400 young people and their families waiting desperately for treatment and support. And the only conclusion that I can draw is that the Conservative government are knowingly and willingly failing our children and young people, because we know what we need. We need genuine parity of esteem. We need to use the standard we expect for physical health patient treatments as a template and apply them to mental health patients. And we need mental health services that are truly responsive to the complex conditions that our young people frequently present with. And we need to listen to young people when making decisions about the mental health services they use. And I will ask the Minister once again, will he listen to those of us who are calling for the government to do more for young people with mental ill health and deliver on the promises his party have been making, promises that they have so far been breaking? As a former social worker, I was surprised that the government's Queen's speech failed to commit to a review of children's social care, the vital system which is designed to protect some of the most vulnerable in our society. It is a total and utter dereliction of duty, which follows cuts of almost a third in children and young people services since the Conservatives came to power. Children's social care is coming apart despite the best efforts of hard-working councils around the country. And it should not be about this. It should not just be about firefighting. Social care should be providing a support system to support every child, giving them the best opportunity to have the best start in life. And whether that's in the form of late intervention, such as safeguarding teams stepping in instances of abuse or neglect, or early intervention like children's centres and programmes supporting parents and youth services, children's services are not only about looking after children in care, but they provide effective family support services, helping more children to stay with their homes if it's safe to do so. The Conservative Party manifesto recognises the underfunding of children's social care, but does the Minister agree that local authorities still do not have sufficient resources to address rising demand, even if his government delivers on its manifesto commitment? Thank you.